Governor Abbott says it's time for Texas to relax the state's pandemic restrictions.
We can continue to tame COVID until more treatments and vaccines become available.
Why he's letting some businesses serve more customers while keeping others shut out. More problems for people who need help from the Texas Workforce Commission.
We're at the last ends of our money. Our credit cards are gone. Everything is kind of zeroed out right now.
Unanswered calls and emails are keeping some Texans from making an appeal after being denied unemployment. Meanwhile, our investigators learned the state is trying to get back millions paid out by mistake. Hello, thank you for joining us for State of Texas. I'm Josh Hinkle, and this week I'm joining you from my home studios once again as our crew continues to social distance during the coronavirus pandemic. This week we start with the Texas Workforce Commission on the hunt for hundreds of millions of dollars in unemployment checks it should not have paid out. Since mid-March, the TWC has paid more than $26 billion in unemployment benefits to nearly 2 million unemployed Texans. But as investigator Jody Barr uncovered, the state might have paid money to people who never secured benefits in the first place.
That's all it shows, July 15th, and essentially it's just a bill. Your monthly payment is past due. Please remit at once. This is $1,460.
Jonah Hernandez has spent the past 2 months trying to figure out how he got tangled up with the Texas Workforce Commission. He says he was never unemployed and never filed for unemployment. And that never hit your bank account?
No, that never hit my bank account. I've got the statements to show from the time that they claim this was issued, which was back in July, all the way until now. Nothing shows that I ever got that extra $1,400 in my account.
Hernandez has email and cell phone records showing he made multiple attempts to reach the TWC.
And so I tried calling, immediately get hit with the message that there's too many calls coming in, we can't, too bad. Hernandez
might not be alone. The TWC says it overpaid 185,000 Texans, more than $203 million in benefits since the pandemic hit in March.
An overpayment is caused when TWC pays unemployment benefits that you were not eligible to receive.
The TWC would not agree to interview with us on this issue specifically, instead posted this recorded statement to its Facebook page. The commission admits it does not make sure recipients are truly qualified to receive benefits before they're paid.
The bottom line is that our priority is to pay eligible individuals as quickly as possible. If we waited until all the information was completely verified, it would not meet federal guidelines.
The message to those with overpayment notices: those debts will never go away.
There is no statute of limitations on debts owed to the state, and TWC cannot forgive or dismiss the overpayments, and there is no exception for hardships. You must repay those benefits even if the overpayment was not your fault.
It just says, hey, payment's due in like a week from now, this is how much you owe.
You never asked for this.
Yeah, exactly. I never asked for it, and then to think that it is taking away from people who do need this kind of money, who do, this $1,400 could help somebody make rent this month. And then I hear about people who haven't even gotten money yet, who have applied for unemployment, and they're being withheld because they're not eligible. And it just seems like it's a whole mess now.
Well, the question now, what do you do if you're in Jonah Hernandez's situation? Since each of these cases are unique, the TWC says you're going to have to get someone on the phone to sort it out. But that's tricky when hundreds of unemployed Texans are telling us their calls to this agency are not getting answered. Many of those calls are now dealing with people who've had their unemployment claims denied and want to appeal. But let us warn you now, if you're planning to appeal, get ready for an 18-week wait.
I don't see the bees. I see these new bugs, though.
Felicia Armstrong and her sister, Sharita Rawls, spend their days entertaining their children and waiting on the state of Texas.
The previous ruling is we can pay you unemployment benefits if
Rawls was let go in March and went on unemployment. Weeks later, her company filed an appeal, which stopped her unemployment checks. After 3 more months of waiting, the TWC decided on the appeal, and it seemed like good news.
It tells me that I won my appeal and I'm due for my unemployment benefits.
But as of this date, not a dollar.
Not a dollar. July 3rd. here we are, September.
It says the appeals department has received your appeal. They are currently working on appeals submitted in early May.
Sister Felicia was let go from the same company in May. In June, the state denied her benefits, so she filed an appeal to show evidence why she believes she qualifies for unemployment. 90 days later, the TWC still has not scheduled an appeals hearing.
I just want to be heard. I just want to let them know my story. Right now, that's all. And I'm pretty sure that's what everybody wants. Texas they're not taking care of a lot of people. My story is a lot of people's story right now.
It's true. As of August, the TWC's already received as many appeals this year as it did in all of 2019. The worker or the employer can appeal a TWC decision to pay or not pay benefits. There are 2 levels of appeal. The first stop is called the tribunal. TWC records show last year it took an average of 32 days for tribunal appeals to be heard. By May of this year, wait times doubled, taking up to 77 days. If there's disagreement with a tribunal's decision, the second step is to appeal to commissioners. The wait times there are even worse. Last year, it took 132 days on average for commissioners to hear an appeal. When the pandemic hit in March, our analysis of wait times climbed to 158 days on average. The TWC tells Felicia Armstrong it's working on appeals filed in May right now.
Early December, hopefully.
Thank you for calling the Texas Workforce Commission.
Now, after hundreds of calls and emails to the state, both these sisters are getting desperate for help.
Reaching out to the TV station as far as we got now, and we feel confident.
Hopefully this makes a difference.
Yes, hopefully it makes a difference. It's unheard of, but hopefully it makes a difference.
Of the more than 100,000 cases appealed so far this year, 1/3, that's 31,000 appeals, do not have an appeal hearing scheduled. You're likely asking, what's the TWC have to say? Well, we asked Executive Director Ed Cerna for an interview, but he would not meet with us. I got a letter from TWC Chairman Brian Daniel a few weeks ago where he offered this explanation. TWC has experienced a 1,500% increase in the number of appeals filed weekly. The current time frame to process an appeal is 45 to 60 days. This represents a 150% increase from this time last year. But the people we showed you in this report and the dozens of people I've spoken with by phone tell me it's taking much longer, 18 weeks in some cases. We also asked Governor Greg Abbott for an interview to find out what he plans to do about the TWC's continuing troubles. But in multiple messages and calls to Abbott's office, the governor's office has not responded to any of our interview requests. Josh?
Thanks, Jody. We've been investigating these problems since March. That's when our investigative team started gathering more than 100 names of people who contacted us. We took that list to the Workforce Commission in July, and it worked. The agency tells us it has contacted nearly all of those people now. After that report aired, we heard from more than 700 additional people all across Texas. Last week, we delivered those names to the Texas Workforce Commission. We'll let you know what happens with that new list. You can find our investigation and how we've helped unemployed Texans in this story on the Texas Politics section of this station's website. TWC isn't the only place where Texans are facing busy signals and long waits.
Whenever you call, it's unreachable. Nobody picks up or anything.
The backlog facing nurses who need licenses to work in Texas.
The governor gives more Texas businesses the opportunity to expand operations during the pandemic. I'm Wes Rappaport at the Texas Capitol. I'll have that story coming up.
CDC data taken out of context, how a misinterpreted statistic is putting pressure on state leaders to roll back COVID-19 restrictions. There's a new problem in Texas for nurses and soon-to-be nurses. They can't work without a current license, but getting through to the Texas Board of Nursing is about as challenging as reaching the Texas Workforce Commission. Maggie Glenn looked at what's behind the busy signals and how the board is trying to clear the backlog.
I'm originally from Nepal, and I came here to get my bachelor's degree.
Nursing student Lap Kalama has been trying to apply to take her first nursing license exam since June. After filling out the required information online, she's left without answers about the status of her application.
Whenever you call, it's unreachable. Nobody picks up or anything. So yeah, that's that. And I've emailed them probably more than 10 times.
The Board of Nursing says it's usually able to handle 4,000 calls per month. Since the pandemic began, the calls have doubled.
That in itself has been a challenge for us. And beside that is the emails to the agency have tripled.
Usually the board is able to hire temporary staff to answer calls during peak times, which coincide with graduations. But since the governor requested state agencies cut their budgets by 5% amid the pandemic, the board says it doesn't have the funding this year.
Our normal processing time is 5 to 10 working days for anything that we do. That's moved to 15 to 20 days.
Others have waited longer. Back in May, Alan Harris applied to transfer his license from Louisiana to Texas to be closer to family. After multiple calls and emails with no answer, his contract in Louisiana now expires in 5 days.
I'm currently going to be without a job here within the next week or so.
In the meantime, the board is asking for patience.
We will eventually get there. I can see it because we're going to put some more staff on the processing part now.
Maggie Glenn for State of Texas.
Governor Abbott says the numbers show Texas is taming the coronavirus.
Hospitalizations is the most important information about the severity of COVID.
The data driving his decision to let some businesses operate closer to full capacity and why he's keeping others shut down. A misleading number puts pressure on state leaders to move faster to end coronavirus restrictions. How data about virus deaths is being taken out of context. Texans will soon take new steps toward returning to normal amid the pandemic. Governor Greg Abbott is giving some Texas workplaces more freedom to reopen and serve more people. Wes Rappaport looks closer at these relaxed restrictions and the key metric on which the governor is basing his decision.
Governor Greg Abbott gives the green light for retail, restaurants, office buildings, manufacturing, museums and libraries, and gyms to expand from 50% to 75% capacity starting Monday. This applies to areas where COVID-19 patients make up less than 15% of people in hospitals.
When COVID hospitalizations are high, it means that the spread of COVID is excessive.
Abbott says 3 regions, the Rio Grande Valley, Laredo, and Victoria, don't meet the hospitalization threshold to reopen further. That's a key metric in guiding the governor's decisions.
Hospitalizations is the most important information about the severity of COVID in any particular region. It is also the most accurate information available on a daily basis.
In Abbott's announcement expanding options for most Texas businesses statewide, the governor notably left one cornerstone of the Texas entertainment industry out: bars.
We need to work with the bars on effective strategies that will ensure that when they do open, the possibility of spread of COVID is contained.
Bars that properly recategorize themselves with the state as restaurants can open their doors, but state leaders recognize there is still more work to be done.
We should learn a lot from this. The thing that the summer taught us was the risk, the danger, the devastation, the destruction, the loss of life that COVID-19 can cause. I lost a very close personal friend.
The virus is still out there, and we still have to be smart about what we're doing.
I'm Wes Rappaport for State of Texas.
We wanted to take a closer look at the change in hospitalization numbers. State data presented this week showed that at the peak, people with COVID-19 made up almost a quarter of patients in Austin hospitals. Now they account for less than 4%. Health Authority Dr. Mark Escott said part of the decline is because most people infected now are younger and healthier. For a deeper dive into the governor's reopening announcement, we go to our reporter panel. Nicole Cobbler covers politics for the Austin American-Statesman, and Wes Rappaport is our State Bureau reporter. Welcome to both of you.
Thanks. Thank you.
Sure. So Nicole, let's start with you. The governor now says hospitalizations are the most important number when it comes to reopening. How different is that from when he was doing something else before? What are some of the reasons he's making this change now?
Yeah, that was really a shift from his previous, decisions to reopen. I think what he used to focus on a lot was the positivity rate. He actually made no mention of that yesterday. And he also focused a lot on new cases. He also didn't really talk about that, but he did say yesterday that he would be looking at all the sort of important measures, but really would focus on hospitalizations. It's not really clear like why that shift happened.
Mm-hmm. Wes, the governor has some critics who say he's changing the standards and moving too fast. How's this playing politically?
Well, you do have the concern there that at least from some that we've heard from, that say, this is moving the goalposts, right? We're looking at the positivity rate. Okay, we're not looking at that anymore. Election day is about 6 weeks away here, and so there are some concerns, especially among Democrats, that some of the decisions are being made with a political perspective, with a political angle. Certainly, I'm not the person to make that judgment, but we know from the far right that there are calls to just reopen everything, and so he's faced criticism there. We know from the far left that there are concerns about how the advice from the doctors and how he's analyzing the data and how that's being used.
Nicole, the big omission from the governor was the reopening of bars. A lot of people have pressured the governor to move forward on that front. What did he say about leaving them out, and what's been the reaction so far?
Yeah, I was kind of on the edge of my seat yesterday to see if he would reopen bars, because you're right, that business groups and members of his own party have really pressured him to do that. He mentioned it. He said we're not going to reopen bars at this time just because he still feels like these are areas that would spread COVID, and he did say that they're working on ways to figure out a way to safely reopen these businesses. But it's going to take some time.
We've seen officials like Nimkid, Dr. Hellerstedt, Dr. Zerwas. They've been with the governor for most of the press conferences. Who are some of the folks behind the scenes that the governor's working to make these decisions, and especially in light of kind of this shift in things?
Yeah, he does have task forces for reopening and for infectious diseases. It's definitely all the people that we see that he's working with regularly. Another person that I talk to a lot is Dr. Mark McClellan, who is on that task force I mentioned for reopening. He's one of several doctors that the governor, from what I understand, is regularly in contact with about the best and safest ways to reopen.
So Wes, we've covered bars and the numbers change. Any other surprises from the governor's announcement?
Well, I think that if you just take a step back and look at the big picture overall, we've heard from other members of the legislature, the lieutenant governor, the speaker of the House, that this is a step towards freedom and that this was because Texans worked together. Some have said, yes, there is a lot of unity on this, and that people have followed those best practices, the hand washing, the mask wearing, and the social distancing. I think there's a lot of people that disagree on the approach, whether that's broken down by party, by region, urban, rural, I don't know, but we have definitely heard from groups of people around the state with very differing opinions. And so I think that will be something just to keep in mind that as we move forward here.
All right, Nicole, Wes, thank you for being with us.
Thanks.
Some critics of the governor are taking data on COVID-19 deaths out of context.
It's not interpreted as this being a positive.
A statistic from the CDC being misinterpreted, how that's pushing some people to pressure the governor to move faster to reopen Texas. Governor Abbott's orders take effect tomorrow to let many businesses expand capacity, but the governor is facing critics who say he did not go far enough. Most of that criticism is coming from fellow Republicans. Politics reporter John Engel finds out how a statistic from the CDC is being taken out of context to fuel the argument.
It's not interpreted as this being a positive.
Beneath almost every social media post from Governor Greg Abbott, demands to reopen the state and drop the statewide mask mandate. Some citing a CDC bulletin that only 6% of coronavirus deaths were among patients who didn't have other health complications. It's a message Dr. Mark Casanova is hearing too often.
It's actually quite ominous that a full 6% had nothing more contributing to their loss of life than a COVID-19 infection.
CDC data tells us 60% of American adults live with a chronic disease. 40% have two or more. President Trump shared a tweet in August that said the CDC quietly updated numbers to admit only 6% of deaths were actually caused by COVID-19. It was removed for being misleading. Now Abbott faces pressure from some in the party that he leads, including the Dallas salon owner who defied his orders and is now running for Texas Senate.
Donald Trump doesn't have responsibility for conditions on the ground in Texas in the same way that the governor or the legislators do.
A recent UT Tyler poll found 71% of Texas Republicans believe the coronavirus is a major health threat. Political experts say the angst from a majority of Republicans is less about whether the virus is real and more about the toll it's taking on the state economy.
That puts Abbott in a tough position, and it puts some of the legislators in a tough position vis-a-vis Trump versus Abbott and where they locate themselves going into a very tricky election.
For State of Texas, I'm John Engel.
Thank you for joining us for State of Texas. I'm Josh Hinkle, and we'll be back next week to bring you an in-depth look at Texas politics. Have a great day.